We are back on MorningLine, our final segment this morning, talking about children's mental health. Stigmas attached with dealing with it, and yeah, it is a very real thing. We've got an organization, Mental Health America of Mid-South, that's involved with it. Dr. Kelly with us, Heather Smith. Thanks both for joining us. All right, it's our final segment here, and I just wanted to, cover some of the bases and get a sense from you. I mean, with your organization, if someone's watching today and they feel they have a child or whatever, just because they happen to be watching this show, I mean, how should they reach out? What can they go about doing? And I'm thinking if we can, we'll put your number up, as you said, for folks that if they can reach out. Tell us, what should they do? A parent that maybe is watching this morning. I don't think too many kids are.
Well, a couple of things. Definitely go to our website, www.mhamidsouth.org, and check out all the programs that we have. And you can request resources. We can send resources your way. And we have support for parents as well. We have the caregiver program. And Lynn Woods is over that program. And she actually talks to, parents and adults about the caregiving role. And even that in itself is stressful, right? And it can trickle down to kids. And many of our presentations will have kids that come up to us and say, hey, so grandma or grandpa is forgetting about us. And I know mom or dad is taking care of them, but nobody's talking to us about it. So in some of our mental health and stigmas presentations, we talk about dementia and what that looks like, or Alzheimer's, or any of the other many disorders or illnesses associated with a traumatic brain injury or memory loss. And so we think that's important because you got to have the conversation with your kids. But how do you support them during this time of remote learning, pandemic, extra stressors? Because even though our kids are growing up in the social media age, remote learning is a beast. It is very, very interesting to navigate, right? I'm in 8th grade again, and I know 8th grade the first time around. But I love the fact that the teachers and the administrators are working together with the parents to make this the best experience possible. And I do appreciate all the educators out there. But some of the things the parents can do, keep similar routines, stick to a routine, right? Do a parent self-care. You can't make sure your kid is okay if you're not okay. So do a check-in with you. Okay. Manage your emotions and your behaviors around kids, but also let your kids feel what they feel. Don't tell them stigmatizing words like, you're okay. Stop crying. Because for kids, that might be the way they can, express what they're dealing with. Do daily check-ins and then celebrate small successes. It could be something as simple as completing the full remote assignment and having free time for an hour. So you get to do whatever you need to do. Mommy is not going to bother you, right? So these are some things that you can do to help navigate this time.
Heather, anything else to weigh in?
Yeah, I would just add to that. We do provide resources. For example, we have a virtual backpack download kit that has different coloring pages or little exercises that really promote that conversation between a parent and a child about things like identifying your feelings or talking about anxiety and worry. Additionally, in our curriculum, we use a lot of storybooks, and we would really encourage parents to employ that tactic with their kids as well. There's a lot of really great stories out there that can help a child start to think about identifying their feelings or what to do when they feel sad or if they have a worry that's worrying them, And so that's another important resource to mention is just the power of a storybook. And that's something that takes them away from the screen, that you can bond and share that time together, whether you're a parent or a caregiver, whoever you are to that child. And it creates a safe place for them to have that conversation.
We're all about safe. One of the things that we do we provide these presentations for schools, faith-based organizations, churches, community and civic organizations. So anytime you feel like you need a presentation for your youth group or a club in a school, we are available, and all you have to do is reach out, and you can connect with us via website or calling the number and asking for Heather, who covers Middle Tennessee, Patrice, who covers West Tennessee, or me, and I can connect you with either one of those ladies.
What about East Tennessee?
So East Tennessee has an affiliate of Mental Health America, and so they have their own program.
Okay, just didn't want to leave them out of that. And
We're not leaving them out. You are definitely covered.
and with what Heather said too, I was just thinking about, the book and the reading. If anything, if there's a silver lining to some degree of this crazy pandemic with children having to learn at home and many parents having to be home, at least you can maybe embrace that as just time to spend more time with your children. If it's reading, which you would have liked to have done before, but you can't necessarily. They're at school all day and you're at work all day. If you happen to be home, I know you're still working, but find time. You just have to try to view that as a time where, let's make the best of this and talk to them, because any kid's going to be a little unsettled. You're right. Learning at home, some of the stories we're hearing about, virtual learning, it's difficult. It's tough. Spend more time with your kids if you're home with them right now. Here's your chance. And I guess we should say, too, between, West and Middle Tennessee, you serve is it about 25,000 kids in 18 to 20 counties? Is that where Etsy is?
I'm so glad you asked that question. Yeah, so we try to go over and above what our requirement from the state is to reach the numbers, because again, this is about our children and we are passionate and we have a purpose in Mental Health America. So from 2016 to 2017, we served a little over 2,400 kids. 2018, 24,000. Forgive me, 24,000. And 2018 to 2019, it was 26,000. And in this year, even with COVID, we hit about 27,000 kids that we provided services to, resources, swag items in the state of Tennessee. And so we're kind of very impressed with the knowledge that they are leaving our programs with.
And by the way, how you're through the state. Is the funding from the state? Are there grants? I know that's how it originally started. I'm just curious. People always wonder, okay, how are we paying for this? How do we do it? And do you take donations?
So that's a great question. Yes, we absolutely take donations. If you're interested in donating to any of our programs, definitely reach out. And one of the professionals that work with us, you can reach out to Robin Turner, or you can reach out to Jackie Kapnar, or you can reach out to our CEO, Dr. Tom Starling. Any one of those three can give you information about donations, and their information can be found on our website as well. As far as the grant is covered by the Tennessee State for mental health and substance abuse. So we're really excited about their vision for us and how we keep providing this awesome, awesome program.
Well, it is, and I'm glad to see it survives. As we know, in these tight economic times and budget cuts, sometimes a lot of these types of services either are asked to really cut back or are eliminated altogether. We've seen some of that, and I think hopefully this is state lawmakers and others recognizing the importance of dealing with these mental health issues. It's just crucial. I just hope you're not going anywhere.
No, we actually tried to adjust to the time. I'm gonna let Heather talk about that. I See Hope went virtual.
Yeah, I was just going to say, if you're a teacher or if you work at a school and you haven't heard of us or are hesitating to reach out because of the virtual environment that we're offering, I would just really encourage you all to get your schools connected, because we have been making it work. Okay, this is not an ideal time for any of us working through a pandemic and trying to educate our kids, but it's more important than ever before to have these conversations with kids and to take their mental health seriously in a time like this. And so we've really worked hard to make presentations that are engaging. We're very flexible. We will work with schools' schedules. I can give multiple presentations across several days of the week just to fit the school schedule that we all know is changing and is needing someone to be adaptable and flexible to meet. And so that's what we're here to do. And we're willing to work whether we are broadcast into the classroom over Zoom or if we're having students log on and access the presentation on Zoom itself. So we are doing virtual presentations right now rather than in person, but please believe me when I say that we've worked very hard to make it engaging, exciting, and a place where they can really talk about these very important topics at a time like this.
Awesome. I believe you,
And
Heather. What?
Apologize.
What was that?
Go ahead.
I'm sorry, what did you say?
If I can add, one of the other things that we offer that I'm not sure people are aware of, we do mental health screenings online.
Okay.
And they're free, they're confidential. What you do is you log on to our page and you'll see a page that'll take you straight to screenings. And we screen, we have for COVID, we have for kids, we have for adults, and we cover all the mental health illnesses. So say that you are getting antsy as a teacher every time a report is due. Okay, you can go online and click that screening.
Good.
And what it does, it asks you several questions, right? And then it provides.
And it gives you, we're just up against it. But I'm glad you mentioned that. That was worth saying. We've run out of time. But Dr. Kelly, thank you so much for coming on. I appreciate it. There's so much more to this. Go to the website. Heather Smith, thank you both very much for joining us this morning. I'll be back with a programming note right after this.